Hello everyone, I am Dr. Ashutosh. I am a unit head at Sancheti Hospital, Shoulder Department. Today we'll be discussing about the frequently asked questions which I commonly encounter in our OPD. Arthroscopic surgery is a technique where we use to diagnose and repair the tissues. It's a minimally invasive surgery where we make small portals, 3 to 5 portals depending on the surgeries, and each portal is around 1 centimeter. So it's a very minimal invasive surgery where we put the small fiber optic camera through the portals and visualize the joint. Through other portals, we use miniature small hand instruments which are specific for the surgery. We fit to the other portals and look after the structures within the joints and repair. It's a daycare procedure or more 1 day procedure where patient will discharge immediately after surgery in 1 or 2 days. And as it is a minimal invasive, it has a very good recovery time as compared to open surgeries. So it's a very specific and highly technically advanced surgery for the patients. Yeah, we commonly do a lot of surgeries like rotator cuff repair, ligament repairs like labrum, arthroscopic repair in labrums like posterior labrums and slap repairs, dislocation surgeries, even longer bicep surgeries. We remove the loose bodies, we remove the cyst or decompress the cyst along with the decompression of the nerves. We do a lot of surgeries for subacromial decompressions, adhesive surgery like for frozen shoulders. These all surgeries can be done individually or in combination to repair the structures. That depends on the type of the surgery, but generally all the surgeries are daycare procedure. Morely, patient will be discharged at late next day. As the patient is admitted on the same day of the surgeries, we generally get all the pre-op investigations 2 or 3 days before the surgery, so patient will not be admitted for the investigations. We get the fitness from the physician, anesthetist, all the blood tests, investigation are done on OPD basis. Patient get admitted on the same day surgeries, and after surgery patient will be in the recovery, and the discharge will be decided on the status of the patient. If patient is comfortable, can walk around independently, can have food and water without any difficulties, or can pass urine independently without any discomfort, and patient doesn't require any painkiller analgesics in injectable forms, then patient can be decided and discharged on the basis of the patient recovery. That also depends on the type of the surgeries. Generally surgeries last from 45 minutes to 1.5 hours. Before the starting of surgery, we shift the patient to the operation theatre, where we for anesthesia and preparation may take 1.5 more. So total in and out from operation theatre will be around 3.5 hours. Patient will be shifted to recovery room where he will be kept for observation for 30 minutes to 1 hour. And once the patient is comfortable, we shift him back to the room. Patients, all these surgeries are done under general anesthesia. Patient will be sleeping and will not be aware what is going on in the operation theatre. Will be given the general anesthesia. Along with that, will be given the block, which will be discussed in detail by the anesthetist and will explain all the steps for the anesthesia. And once the surgery is over, the patient will be shifted onto the into the recovery room where he will be monitored for 1 hour. Once the patient is stable, conscious, oriented, he will be shifted back to the ward or room. After surgery, he will be nil by mouth for 4 hours. He is not allowed to take any fluids or any food. After 4 hours, he can start having a sip of water. That will be for half an hour. If patient is comfortable, then he can start semi-solid liquids and non-spicy, non-oily stuffs on the same day. And next day onwards, he can start having all the normal food what he have in the daily routine. As I had already discussed, the patient will be given a block which make his hand numb. So it will be off. The pain will not be having any pain for probably 15 to 20 hours. This is a major part where patient will be suffering some pain, but due to the block it will be covered and will be pain free. We expect some mild pain after the surgery, but will be given the patch, the painkiller patch, which lasts for 5 to 7 days. And on that, if you require any painkiller, we'll be giving SOS painkillers in the form of tablets, or if required, injectables. But more or less, patient will be comfortable by taking all these measures. Patient can apply ice packs around the surgical site, where the swelling and pain will go down and patient will be more comfortable. Yeah, that also depends on the type of the surgeries. The surgeries which require rotator cuff repair, labral repair, shoulder dislocation repairs. So these all do require a sling, where it's to be continued for 6 to 8 weeks, but not continuously. But the patient can remove on and off, do some exercise which has been taught after the surgeries. He can use that hand for to drink or have food, or he can write and type anything. But there are some do's and don'ts which to be done by the patient as per the advice of the doctor. In the surgeries like adhesive capsulitis release, at the frozen shoulder release, patient will be given sling for a few days. Once the patient is comfortable and pain free, then we have to discontinue the sling and start doing the exercises which been advised by the doctor. So sling is just to make you comfortable, prevent the injuries, which especially for the repairs, where we don't want it to disrupt the repair, so that it will heal in the accepted position, and then after that we can mobilize and do the physiotherapy. Generally, we don't advise to take showers till you do the suture removals. For generally, suture removals are done around 10 to 12 days. After 10 to 12 days after suture removal, within for 24 hours we can start taking showers, but make sure we keep it dry, and wound should heal in the healthy state. So this is what we advise generally, and we expect the patient to follow and not to wet the wound. Yeah, that also depends on the type of the surgery and which type of surgery we do. Especially the physiotherapy starts at the day one of the surgery, but patient should be aware of that the physiotherapy is the most important component of the recovery. Surgery is one part and physio is the other part, which is equally important in terms of recovery. So we start physiotherapy for some basic exercises on the next day, which will be taught by our physios and the doctor. And once the patient is comfortable, we can progressively increase the exercises by 4 weeks and 6 to 8 weeks, and this will continue as the patient recovers. Follow-up visits are generally when you discharge the patient on the next day or the same day. After 10 days, we call the patient for suture removals. We give some instructions to the patients which they follow for next couple of weeks. They can come after 4 weeks to improve on or increase onto the exercises, and probably after 6 to 8 weeks they need to follow up to see the recovery, and then we'll start with the aggressive physiotherapy. So that to depend on the profession of the patients, where the patients like IT professionals, desk job workers, where they can start immediately working couple of days, where they can use light, computer it can be done, and just desktop we can do it. It's just like an attempt to do the do their work, but may not be able to do the same intensity what they were doing before the surgery. But definitely they can start working. They should be doing frequent breaks, so that they do not put any stress on the shoulder, and should not put a stress on the repair as well. In the patients like heavy workers like farmers, industrial workers, or carpenters, they are not allowed to do the work for next 3 to 4 months. They can ask for some other work like desk job, like supervision work and all these things, but definitely they are not allowed to work to the same intensity they do 3 to 4 months after surgery. Arthroscopic surgeries are the minimal invasive surgeries where we do not have to cut the structures, normal structures, to go into and to repair the surgery, repair the tissues. It's a minimal invasive surgery, so the tissue handling will be less, tissue scarring will be less, it will be a very small scar, it will have less bleeding, patient discomfort will be less, and the patient will be discharged very early after the surgery. As compared to open surgery, the orthoscopic surgery has a lot of we can access to a lot of structures which are not accessible through the open surgeries, so which can be managed accordingly. Patient will be very comfortable and can be discharged very early from the hospitals. Generally, we don't allow patient to drive after surgery as long as the patient is using the sling. When we start discontinuing the sling, patient can attempt to drive, but should be avoided till you get his normal strength. Once he start gaining his strength, he can attempt to drive in open parking or open space where just to get a feel how to drive. And once the patient is comfortable, we can go on road for driving. But generally, it takes around 3 to 4 months to go on to the road for driving. See, especially the surgeries like labrum repairs, where there is dislocation, and there are a lot of structures which are damaged during the surgery, during the sports injuries. This patient require a special care. We follow the general protocol for this rehabilitation, which lasts for 3 to 4 months, which the patient will be back to normal routine activities. But for the sportsman, we need specific exercises, specific exercise protocols which to be followed to bring him back to the normal playing activities. For that, we have to start the sports-specific exercises. So generally, start around 4 to 5 months of the surgeries. We'll be put on a lot of gym exercises. Generally, it takes around 6 to 8 months for a sportsman to come back to the pre-fall or pre-surgery level. But for contact sportsman, we generally avoid to get him exposed for at least 8 to 10 months.